Assalamualaikum warahmatullahi wabarakatuh. Welcome to Hemoparasites. So finally, there's Joe, and let's start. First thing, internal malaria. نمشي تعرفين إنه it's prevalent in KSA. إيش بعد مهم؟ إنه we have four types. We have Plasmodium vivax, Plasmodium ovale, Plasmodium malaria, Plasmodium falciparum. These two, you'll probably remember them from when we had the urogenital parasites. So, Plasmodium vivax causes benign tertian malaria, and Plasmodium ovale causes ovale tertian malaria. Both cause tertian malaria. Whereas Plasmodium malaria causes quartan malaria, and lastly, falciparum causes malignant malaria. And we know that it's dangerous and it can lead to acute renal failure. So, let's see. So first thing, we have the infective stage, which is sporozoites. Now, the mode of infection, of course, is going to be a bite of an infected Anopheles mosquito, specifically a female Anopheles mosquito. And rarely it could occur because of blood transfusions or vertically, which is like congenital from mother to child. So again, we said rare. So let's see how the pathophysiology the pathogenesis occurs. So first thing, we said the infective stage is sporozoites. So the mosquito is going to bite the human host, and as it takes its bite, it's releasing all these sporozoites, which are these stages. So the sporozoites of the malaria enter the bloodstream, and when they enter, they find a liver cell and they infect it. So this is primary tissue schizogeny. Well, basically we have schizonts now. So what are schizonts? Schizonts are like the cell with multiple malaria stages called merozoites. So when there are way too much, this schizont, which is like the liver cell, it's going to rupture, and then these merozoites are going to infect a blood stage. So here is our extraerythrocytic cycle, and here's our erythrocytic cycle. So now it's going to move into the blood cells. Now we have a different stage. The merozoites entered, now we have a different stage called a ring stage. So in this ring stage, we now call them trophozoites. So what are trophozoites? Trophozoites are in the erythrocytic cycle, and they are when there is a ring stage inside the RBC. Okay, so now it's going to undergo maturation. So it's no longer a ring stage. Ring stage, it was immature. Now it's a mature trophozoite. So this mature trophozoite could either continue and give us a gametocyte, or it could continue its growth, become a schizont, which is a cell with multiple merozoites. Then it's going to rupture, then it's going to infect another RBC, and then so on and so forth. So either that, or we'll have gametocytes. So if we have the gametocytes, let's say the mature trophozoite matured into the gametocytes, then we have our mosquito over here. It's going to bite again, to suck blood again. Now it's going to suck up the gametocytes. Now inside, here is the sporogonic cycle, which occurs inside the mosquito over here. So inside the mosquito, it's not really important to know what occurs exactly, but gametocytes are going to emerge, giving us an oocyst. And then this oocyst has multiple structures inside, which are the sporozoites. So if it ruptures, we have release of sporozoites. And how do these sporozoites reach the human again? When the mosquito bites. So we have our phases. We have our primary tissue phase. Okay, there we are. So here are our stages. So we have our exoerythrocytic stage, which is in the primary tissue, and we explained this. We have an exoerythrocytic stage, which is the secondary tissue. So what is this? So we said that the infective stage over here, it's going to rupture and then infects RBCs. Sometimes it doesn't rupture. If it stays as a schizont and doesn't rupture, here it's now latent or like a dormant stage. And then they're called, let me just make it yellow, they're called hypnozoites. These are seen in both Plasmodium vivax and Plasmodium boval, the two tertian malarias. So our stages: exoerythrocytic primary tissue, exoerythrocytic secondary tissue, and erythrocytic schizogeny or gametogeny. So here's our, where is it? Either schizogeny or gametogeny. And this is our erythrotic cycle. And again, we say we have our sporogonic cycle, which occurs inside the mosquito itself. Okay. Also, here's a fact. Both Plasmodium falciparum and Plasmodium vivax are prevalent in South Europe. So specifically vivax and falciparum. Now, it's important to know that when do we get our symptoms? We get our symptoms from the symptomatic stage, which is the blood stage. When it enters the blood, red blood cells, and it ruptures them, and it continues, we get our symptoms. But the liver stage is mostly asymptomatic. So going back here, which is like not that different from the slides. So here's our clinical presentation. So when multiplication occurs in the RBCs, we'll have anemia, toxin release, and release of malaria pigments, such as hemozoin. So first, anemia. Why anemia? I think it's a bit obvious. You can imagine why. And toxin release. So you have 3 stages. Let me just, no, I think I'm going to use this. Okay. So you have 3 stages. Our cold stage, our hot stage, and our sweat stage. So first تجيك زي الرعشة سريعة 10 إلى 15 دقيقة, shivering, and fever. So yeah, this is the cold stage. Then we have our hot stage. It's a bit longer. Fever, flushed face, hot and dry skin. Lastly, sweating stage is to decrease your temperature and sweating for several hours. So this is a cycle basically. It's the paroxysm, 3 stages that are like occur after each other. But remember we said we had tertian malaria, quartan malaria, and the malignant malaria. So for tertian malaria, which are Plasmodium vivax and Plasmodium boval, this occurs every 48 hours. So every 3rd day, tertian. So as you can see here, it occurs here, then 48, and after 48 hours, we get the spike again. After 48 hours, we get the spike again. Now for quartan malaria, it's after every 72 hours, and you can see it again. So quartan malaria, every 4th day. So after 42 hours, after 3 days, we get it. And for malignant malaria, it's malignant, تسبب مشاكل كثير, it's irregular, you get high fever. It's high fever and like irregular. Okay, so we said we'll have RBC destruction, anemia, toxin release, which is the malaria paroxysm, and release of malaria pigments, such as hemozyme, and literally they're like brown dots colors you'll see in other organs because of from the destruction of the hemoglobin. Okay, so we said that these occur when in the symptomatic state, which is the blood stage, but we have this thing also that occurs. So we said hypnozoites, we have hypnozoites. And we said that hypnozoites are in Plasmodium vivax and Plasmodium ovale. Hypnozoites are a dormant state. That means we can expect them to relapse. So we have true relapse and not true relapse, which is recrudescence. So for true relapse, it's for the uh, it's for the two plasmodiums with the hypnozoites, which are Plasmodium vivax, Plasmodium vivax, and that's because the reinvasion of RBCs by the merozoites from the dormant hypnozoites that are released during the secondary tissue phase of the liver. Or we can have recrudescence, which isn't a relapse, it's just a reinfection. And this is for the other two without any merozoites, hypnozoites. And it's basically a reinfection. So we said that Plasmodium vivax and Plasmodium ovale are relatively benign. And if you remember from your general parasites, Plasmodium malaria causes nephrotic syndrome. So, in my bad. And we explained how it occurs, and it's because of the soluble immune complexes, the third type of hypersensitivity. They enter the glomerular capillaries, and they cause destruction of the glomeruli. We also have Plasmodium falciparum. The malignant malaria has serious complications, so we have three. First, which is very important, we say we have anemia, لكن we will have pernicious severe anemia. So pernicious anemia. تذكر وشيخة. Then we have black water fever, also from urogenital parasites. So it's mass hemolysis that will eventually lead to acute renal failure. There's a lot of details that can have remind me. I won't go into it, honestly. And lastly, the RBCs, it affects the RBCs, so they have this knob-like protrusion. What's this going to do? This is going to cause both resetting and clumping of the RBCs. So resetting happens when the infected adheres to the uninfected. So they look like this, and clumping is when they're all infected. We lost game for that. Basically, they're like emboli, and they cause hypoxia or infarctions, and they cause both cerebral malaria or algid malaria, which is both are about shock. Like cerebral malaria, basically, it's going to cause convulsions. Okay, very slow. And then to cause convulsions for us because of the interrupted blood supply. And algid malaria causes hemodynamic disorders, all which will lead to shock. And if untreated, it's fatal. Plasma falciparum is the malignant, and if untreated, it's fatal. Okay. So you can see here we have tertiary. Okay. For lab diagnosis, yes. So here's the golden standard microscopy. We want thin or thick blood film. What are we going to see? You can either see the schizons, the rings, or the gametocytes, anything. Then you can do the serology, which is a rapid diagnostic test to detect the antigen. And it's not really that important, but you can do the nucleic acid detection, the PCR basically. Don't write this, but this is basically PCR. Like for treatment. First thing, remember they're all queens, okay? They're all slay. So first line, you're going to focus on the clinical symptoms. So بيجيك شخص not diagnosed yet, but they have the symptoms that indicates malaria. So basically, you're going to give them the first line treatment. These are for plasma oval, vivax, and malaria. So first thing is chloroquine, the main one. But if the person has chloroquine resistant malaria, you can give them mefloquine or artemisinin. And we said that plasma oval and vivax they have the hypnozoites. So you're gonna give them Primacoin. So like it's the premium subscription because he had جري لابس had رجله قال you know what نبغى مرة ثانية you get Primacoin. بس ما ينفع يكون لا ما ينصح مع هذا لأنه هو يعني بارستاشفا. So you're going to use artemisinin combined therapy. So you use these two together, either artemisinin or quinine, with an antibiotic such as doxycycline, tetracycline, or clindamycin. Okay, doxycycline isn't an antibiotic, but okay. But if the condition is complicated, as in the patient was unconscious, didn't have a clinical presentation, okay, here you're going to give them IV artesunate or quinine. So it's not artemisinin, it's artesunate or quinine, and then Apagam, you give them their oral medications. Okay, so last thing, we're going to be talking about treatments. So for control, for prevention and control, you treat the cases, you do mosquito control, and there is vaccine in children now, and also we have chemoprophylaxis. So chemoprophylaxis is if someone's visiting an endemic area. Now, if the person is completely healthy, give them the casual prophylaxis. What is that? We have primaquine or pyrimethamine. pyrimethamine. بس خلاص يعني هو هذا healthy person خلاص عنده premium subscription كذا خلاص primaquine. But if this person is clinically free, like right now, but they do have malaria, so you want to prevent the attack, you use أحسن واحد اللي هو chloroquine or بديله mefloquine. Okay, so this is all we have right now for malaria. It's kind of overwhelming, but it's not that bad. Now let's go on to toxoplasmosis caused by Toxoplasma gondii, and you probably remember it from the cutaneous parasites. So just as you can see, first thing, because they're hemoparasites, they're all protozoa. So Toxoplasma gondii is a protozoa. How we know, if you guys remember, its definitive host is the cats, and it's ينتقل through birds, which could be like chicken, which you may eat, like shawarma. And this definitive host can transmit it to humans. And something that's special here is that there is vertical transmission from mother to child. Okay, we can start now. So the mode of infection, it could be acquired or congenital. So it could be foodborne if you ate any of these meats. Okay, just the oocyst. So most important, we have the oocyst. Or there are cysts inside the tissue from the undercut meat. Oh, my bad. No, the oocysts are from the cat feces. So أصلا كثير يحبون من أطفالهم ما يلعبون في litter boxes like their cats. And this is most likely the reason because they have there are oocysts in cat feces. And then we have tissue cysts. This is what you get from the undercooked meat. And parenteral, if عندك جرح we came in contact with infected meat, so it directly goes into the bloodstream, or blood transfusions because it's a hemoparasite, organ transplant, and we'll get into this, and which is basically because it has cysts in organs. Okay, or important, since we're not having toxoplasma, we can have congenital, transplacental, or vertical. So toxoplasma, transplacental. So what happens in toxoplasma? So mainly, if someone is immunocompetent, they will be asymptomatic. So they'll have cysts in their tissue organs, but they won't feel anything. And the infection is common, but the disease is rare. So they'll have cysts in their organs. So that's why during organ transplantation, if the recipient could be immunocompromised, they may, in a second. So immunodeficient, it could be that immunocompetent, when they become immunodeficient, there is reactivation of the cyst or recrudescence, and this will cause a disseminated infection. So it's going to go to the brain, cause encephalitis, to the lungs, cause pneumonitis, and it's fatal. So this is an opportunistic infection. So the أمشتاكين يجي in multiple organs and a disseminated infection. This is for the acquired. What about the congenital? So for the congenital, the parasite صح قلنا إنه هنا يكون كده بين disseminates. هنا لا لأنه يجي من البلاسنتا. It's going to be generalized and then it localizes in the brain, in the eye, wherever. Just mainly like سؤال هذا brain and eye عشان تفهم what could it cause. So first, it could cause stillbirth and aborting the baby, or it'll have early manifestations. So what are these early manifestations? هو كلهم حرف C. So they're all حرف C. We could have hydrocephalus, either micro or macrocephalus, or we could have cerebral calcifications. ممكن نركز brain هنا. So cerebral calcifications, as you can see over here, and these will cause convulsions for us. So that's our third C. And lastly, we can have chorioretinitis over here. You can see it looks like this. It's because of inflammation of the membrane of the eye. So the brain and the eye mainly affected by toxoplasma gondii. Actually, the زي كذا كأنها هنا. So the brain and the eye. Don't forget this baby over here. These are the early manifestations. But we also have late manifestations. So this could occur either not in babies, so either in adolescents or adults. So they're late manifestations. So this person's development will also be late. So they have mental retardation and blindness. And now again, eye, chorioretinitis, they could have blindness. So for diagnosis, we could do serology and find the antigens, or imaging, CT and MRI, and this is what you'll mainly find. For the treatments, honestly, I tried and it's a bit hard. So you have pyrimethamine. So if you remember what pyrimethamine was over here for our casual prophylaxis. Or sulfadiazine, or trimethoprim and sulfamethoxide. Yeah, okay. هذول. طيب. Or during woman's pregnancy, so P pregnancy, if it's more than 18 weeks, we have spiromycin. And spiromycin is mainly to decrease transplacental transmission. So spiral ليه؟ عشان دم هو ينزل زي كذا يصير transplacental لا يلخبطه كذا يحوسه يصير له spirals عشان يقلل ال transplacental transmission spiromycin. Or it could be equal to 18 weeks or more. So we have pyrimethamine again and sulfadiazine, which is basically the main treatment. Okay, the treatment شوي صراحة ملخبط فيها بس مو بس قراها. Okay, on to leishmaniasis. So if you remember, we had something called cutaneous leishmaniasis last year, but now we have visceral leishmaniasis. So our parasite is Leishmania donovani complex. كأنه إيطالي. Leishmania donovani complex. Fancy. Okay, so our definitive host here is the human and also mammals, so it could be rodents, dogs, mayhem. Here we have our vector, which is the sandfly, if you remember. Phlebotomous, candylobotom. Okay, and here's what's important. Our infective stage is the promastigote. Promastigote means that it has a flagella. And its mode of infection is the sandfly bite. So our vector here introduces the promastigote into skin. So how does it occur? So when the bite occurs, the promastigote enters, and once it enters تحسبون الجسم ساكت no, the macrophages على طول phagocytes it. But jokes on it, unfortunately, the promastigote needs this, so it transforms into an amastigote. Yes, so the second stage يرجع إلى the first stage اللي بدون أي flagella عشان يقدر يتكاثر وبعدين يفجر لك الماكروفاجز. بعدين الamastigote هذه تروح إلى various tissues, specifically reticuloendothelial cells. We'll get into it now, like in a bit. بعدين نفس الشيء يجي ساندفلاي ياخذ عظمة مرة ثانية ترجع داخل الamastigotes and الamastigotes بعدين ترجع إلى promastigotes تتكاثر again وترجع مرة ثانية. So صراحة سالفة شوي بيض بس yeah ما قصر. The thing is يعني كان شوي بيض لكن it has high mortality. This is very dangerous. So هذا الإشميميا دونوفاني complex قليل أدب. So early symptoms, we have early symptoms and late symptoms. It's just important that you know basically like أشياء سطحية شوي هنا. So first they have a fever. It's characterized as intermittent and double daily rise. So there's an increase in the temperature twice a day. ما لقيت أي صورة unfortunately. They also have malaise, fatigue, weight loss, and late symptoms. بيصير هذا weight loss يوصل حد الكيككسيا. And we said also that it affects reticuloendothelial cells. صح? So what's going to happen? We'll have hepatic dysfunction. So what occurs? Jaundice, edema, hypoalbuminemia, which is the cause of edema. So reticuloendothelial cells are basically the blood cells, the spleen, the liver. So we'll have hematological alterations and diarrhea symptoms. Also, reticuloendothelial cells include lymph nodes. So what are we going to see? We're going to just real quick. So we have liver, and lymph nodes. So we'll have anemia, we'll have leukopenia, تسكشيجات القلب unfortunately and thrombocytopenia. So all our blood cells get القلب. But what will we have? We'll have hypergammaglobulinemia. Well, that's one thing. عشان يعوض. So our reticular endothelial cell symptoms, we have lymphadenopathy and hepatosplenomegaly because they want to compensate, so هذول بيزيدون هذول هم reticular endothelial cells. We also have this condition, which is post-Calazar dermal leishmaniasis. And it's basically so many fluid-filled vesicles on the person's face and neck. So post-Calazar dermal leishmaniasis بيكدو هذا visceral leishmaniasis. So from this, what would it be our diagnostic stage? So inside the human's body, we have amastigotes. Inside the sandfly, we have promastigotes. So for diagnosis, what are you going to find? You're going to find the amastigotes. So you see the amastigote in the tissue. So if you're going to diagnose with microscopy, you may see amastigotes in blood, in the organ tissue, or in bone marrow aspirate because it's going to the reticular endothelial cells. You can do serology دائما و PCR زي دائما. التريتمنت مو معانا and this is for diagnosis. أتوقع بيكون مهم لللاب but not for now. Now we have our last disease, which is trypanosomiasis. If you remember, we have our African sleeping sickness and our American Chagas disease. And now when I see Chagas, I can't stop thinking about that one TikTok song. I know you know it. But so our infective stage for African trypanosomiasis is Trypanosoma brucei, and and for the American Trypanosoma cruzi. So عشان تذكرين cruise ship, that's such a Hollywood thing. It's American. Often it's not the same America بس خلاص. And we have Trypanosoma brucei. So the mode of infection depends on the vector. So the vector here is the tsetse fly, corona من probably الأحياء, and which is also known as the Glossina. Here we have the triatomine bug. The mode of infection for African is simple, just Glossina bite or the tsetse fly bite. This for the triatomine, أصلا triatomine معقدة طولها ما هي زي tsetse cute. It could be triatomine bite, could be blood transfusion, could be organ transplant, or transplacental vertical. Now, do you remember which was also transmitted transplacental? That was the toxoplasmosis. Okay. The pathogenesis, basically, it's going to bite your skin, enters the blood, enters lymphatics and onto tissue. سيسوي بلا في هذا وهذا ما قصر. Thank you so much. For lab diagnosis, so microscopy, we're going to detect the parasites in the blood film, if you remember. Polymorphic trypanosomes for the African and monomorphic for the American. The American عادة صغيرة بس واحد monomorphic بس in Africa شوي أكبر, so polymorphic. And also you can do serology and PCR. Same as serology, that's antibodies. Okay. So the pathogenesis, first we said skin to blood to lymphatics to tissue. So what's this going to do for us? we can see over here. So we have the trypanosomal chancre. Somehow I don't remember it, but you know, banana and Mali. I think it's going to be a skin lesion basically. And also, we're going to have fever because it's an infection. Our fever is going to be irregular and cause headaches. We'll have lymphadenopathy because we said it passes lymphatics, and hepatosplenomegaly because manage. So because it's sleeping sickness, it's because you have sleeping disturbances. Well, if you have sleeping disturbances, it feels like you're going crazy. So you'll have neurological symptoms. It could be motor, sensor, psychiatric. This is going to be associated with convulsions, coma, and co-infection. So anything neural and related to sleep, relating to sleeping sickness, relating to African trypanosomiasis. Whereas for the American, we said it's Chagas disease. It's going to give us the chagoma over, opposite the chagoma over here, which is a nodule on the skin, or Romana's sign. Okay, Romana. كان هذا اسمعني صراحة. كان بس أنا American Romana نفس الحروف تقريبا. anyways Romana sign نفس الشيء بس عند so if it happens in a child يكون يعني خلاص يكون الأشياء المعروفة عندنا fever and the headache. But here we have also fatigue, not fatigue. Again, it crosses the lymphatics, so we have lymphadenopathy and hepatosplenomegaly. إذا جاوبت عند الadults, so let's see إنه الأمريكانز نظامهم الغذائي very bad. So يكون شيء chronic طبعا عليه وخلاص يعني كلهم يصيرون obese و whatever. So كل أعضائهم تصير خلاص كبيرة. Chronic in adults, the American causes cardiomegaly. طبعا it could lead to heart failure. It causes mega esophagus, mega colon, like oh my god, just look at it. And meningoencephalitis. So mega syndromes, mega viscera, chronic in adults of American trypanosomiasis. It may be silent for a decade. So our vector bite will cause the both Trypanosoma brucei and Trypanosoma cruzi, depending on the infection. So our trypanosomes over here, they're going to spread via hemolymphatic system. In the African, it's going to multiply because we have polymorphic trypanosomes, and in the American, no multiplication, non-lonely. But then it's going to go to our organs and tissues, CNS in the African, causing sleep disturbances and neurological manifestations, convulsions and coma. Or it could go to the heart, the GIT, and the CNS in the American, causing the chronic symptoms of cardiomegaly, megaesophagus, megacolon, and meningoencephalitis. بس الله يوفقكم يا رب.